औज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम अर्रहमान अल्लमल कुरान खलक़ल इंसान अल्लमहुल बयान। जैसे कि आप जानते हैं कि हम अपनी क्लास शुरू करने से पहले या बात शुरू करने से पहले एक पॉजिटिव बात शुरू करते हैं। तो रिमेंबर ग्रेटनेस बिगिंस बियॉन्ड योर कंफर्ट जोन। आप याद रखिए कि अगर आप मेहनत कर रहे हैं तो मेहनत इज़ नॉट एन ईजी जॉब, इट इज़ वेरी हार्ड थिंग। आज का जो हमारा टॉपिक है दिस इज़ ओबेसिटी एंड यू नो इट इज़ वन फॉर्म ऑफ द वन अनदर एक्सट्रीम ऑफ मैल न्यूट्रिशन। तो जैसा कि आप जानते हैं कि इंट्रोडक्शन, कॉन्सेंट, हैंड सैनिटाइजेशन और एक्सपोजर के बाद आपने जनरल लोग देखना है कि सिक है, वेल लुकिंग है, साइनोज्ड है, रेस्पिरेटरी डिस्ट्रेस एड्रेस्ड है या नहीं, is there any pallor or jaundice, what is the nutritional status, which is obviously you see the child will be very fat for his age, diagnostic or dysmorphic features. This is very important and you can make it out in general look that if the child is having moon face, this plethora and hirsutism, you can make it out that the child is having Cushing syndrome or Cushingoid facies. If there is a coarse facies, you can say it's a child is a hypothyroid. If the child is having round immature facies, they are called cherubic or angel-like. You can call it a growth hormone deficiency. So midline defects point towards the pituitary defects. After that, you just assess the mental status by asking us some few questions like what's your name, in which class are you studying. So it will tell us that in mentally retarded patients are the following syndromes such as Prader-Willi syndrome, Lawrence-Moon-Bardet-Biedl syndrome, and untreated hypothyroid. Followed by the general look and a small impression on mental status, you just go for the anthropometry including the height, weight, and FOC. Remember, obesity with a normal or tall stature is most likely normal. However, obesity with a short stature is pathological. Followed by this, come to the hands and check for the polydactyly. If this polydactyly in Lawrence-Moon-Bardet-Biedl syndrome, check for the bradycardia which is present in hypothyroid, the respiratory rate, and touch for the temperature. At this time, you can put thermometer in the armpit too. Arm blood pressure you should ask at the end. Skin striae for the Cushingoid, cafe au lait spots macunal bright. After that, go for the eyes and you need the fundoscopy to see the retinitis pigmentosa which is present in Lawrence Moon, Allstrom and visual defects. But you can tell at the end of the examination that I want a formal eye examination for these abnormalities. Hearing deafness or hearing aid will be present in Allstrom syndrome. And when you check the mouth, the repaired cleft lip or palate will be in hypothyroid. In the neck, you can check for the goiter, and abdomen, you check adrenal mass hypertonia. Then you ask the permission of the examination for examiners for performing Tanner staging, which is advanced in Cushing and hypogonadism in Prader-Willi or Bardet-Biedl. Then you check the legs for edema, delayed ankle jerk. Then the gait is checked by the limb, subcapsular femoral epiphysitis, and proximal myopathy, which is a sign of Cushing syndrome. At the end of the examination, say that I would like to complete my examination by taking blood pressure, plot, height and weight, and FOC on centile charts and perform formal hearing and visual and developmental assessment. I have made a hypothetical description that I have just examined a 10-year-old Junaid who was conscious and cooperative during my examination. He was well-looking, obese child without upper respiratory distress or cyanosis at rest. There was no jaundice or pallor, and is no diagnostic or dysmorphic features. His height is 110 cm, which appears to be short of his age. Weight is 50 kg. His pulse rate is 83 per minute. Respiratory rate is of 21 per minute and is afebrile to touch. He seems to be mentally challenged as he is studying in class 1. There is polydactyly. He is hypotonic with a small-sized penis. There is no clubbing, leukonakia, koilonychia, no visual field defects, no hearing impairment, and normal oral cavity. There is no goiter, stria, cafe au lait spots. The abdomen is soft and there is no mass. Gait is normal without a limp, and there is no proximal myopathy. I want to take blood pressure, plot height and weight, and FOC on centile charts, and perform formal hearing, visual, and developmental assessment as the child appears to have subnormal IQ. So this was the hypothetical description that I practiced and I have made for myself, but you are requested and you are advised that you should make your own mental rehearsal what you are going to say to the examiner. Then few words on the causes of short stature and obesity, because if you don't know the causes, how will you find the signs? So there's an endocrine or non-syndromic causes and there's a syndromic causes. In endocrine or non-syndromic, the Cushing syndrome is the top, then followed by hypothyroid and growth hormone deficiency. Whereas in syndromic, there's a Lawrence border Beadle syndrome, Prader syndrome, Willis syndrome, Down or Turner syndrome, and Alstom syndrome. Another few words on the visual appearance of this is the Prader-Willi syndrome. You can see the child is a chubby with a small size penis, and it is due to the chromosome 15q and 13 deletion. Maternally derived leads to Prader-Willi syndrome, while maternally derived syndromal genetic defect leads to Angelman syndrome. In the pathophysiology is because of the increased ghrelin level, that hormone that causes hyperphagia, which is and hunger is also called hunger syndrome. So the treatment of Prader-Willi is growth hormone therapy because growth hormone deficient obstructive sleep apnea, BMI, which is found by the formula of weight in kg divided by height in meter square, square of the height in meter. So 85 to 95 of percentile is overweight, greater than 95 centile is obese, and greater than 99 centile is overweight. Then after that, now this is the pictorial representation of Bardet-Biedl syndrome. Look at the chubby, small chubby ants, hypogonadism. Then this Alstom syndrome. What is Alstom syndrome? It's a rare autosomal genetic disorder. Rate of prevalence is 1 in 100,000, and it can present in infancy or early childhood syndrome. Its symptoms are obesity, significantly high weight, diabetes, dyslipidemia, cardiomyopathy, renal dysfunctions, respiratory illnesses, delayed learning, impaired vision, and you have to test of blood sugar, hearing, heart, and lipid levels. There is no specific treatments are available. Only symptoms are treated with the medicines of diabetes, cholesterol, and cardiovascular medicines. Cushing syndrome. Cushing syndrome has the following signs. It is a fat buff pad on the back of the neck that is buffalo hump. There are thin arms and legs. There is skin bruising on the legs, stretch marks on the abdomen, extra face and body hairs, red cheeks, thinning of the hair, and round moon face. These are the stretch marks and stria marks. So the complications of obesity, if the examiner asks, you can tell the obstructive sleep apnea, and system-wise, you can tell these complications system-wise. Serious like hypertension, hyperlipidemia, GIT, non-alcoholic fatty liver, gallstones, constipation, endocrine, you tell about diabetes mellitus, skin acanthosis nigricans, skeletal subcapsular femoral epiphysitis, scoliosis, and psychosocial. So now a few words on the management of obesity. Lifestyle modification: avoid junk food, sugar, restaurant foods, sweets, avoid watching TV while eating. This is one of the few things that you come across your practice, that you will come across many parents who give their kids mobile phones while they are eating, or the kids, they say that the kids don't eat while the time we don't give them phones. So it is very important aspect. Then the aim of weight reduction: 1 pound per month in the children less than 12 years, and 2 pounds per week in the children greater than 12 years. So you should not decrease the weight too drastically. So guidelines for watching TV: less than 2 years should not be given any TV or screen, but greater than 2 years, 2 hours of TV, computer, video games. So dietary guidelines is 30% of the fat, 10% polysaturated, unsaturated fatty acids, and 200 mg per deciliter or less cholesterol. Whole family should adopt healthy diet style. Whole family should adopt healthy lifestyle because the child learns from you. So you should be a role model for healthy dietary habits. You should encourage exercise such as swimming, skipping, cycling, or outdoor play. and you must discourage sedentary lifestyle. Thank you very much for your listening, and this was basically my own personal experience and what I thought is right. You are allowed and you are advised that you should make your own schemes, but you do practice mentally because it's very important to rehearse in your mind before going to the exam. So, best wishes, and I will be looking forward for your comments. And may Allah be our helper, protector, and guide. Ameen. Allah Hafiz.